locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show. We're going to be talking about dermatology and cosmetic dermatology as well here on the show this evening. We're going to welcome Dr. Bertha Baum. She is a dermatologist and cosmetic surgeon. It's drbaum.com, BAUM.com, and we'll give that out a bunch of times. Dr. Baum, how are you doing this evening?
I'm doing great. I'm very happy to be here with you, informing everyone a little bit more about dermatology in our world, and just excited to get into this.
Yeah, and we thank you for taking us on this adventure of health, because we always learn so much from our providers we have on the show. So yeah, let's get right into it. So you're a dermatologist and cosmetic surgeon, and we're right in the middle of a pandemic here, and we're all wearing, mask best. But I got to say, I've developed a little what they call maskne. I can't even say it. I had acne in the past, but are you seeing some of that? Have you been asked about that from your patients? Because as we put things on, we're probably running into this a lot.
Absolutely. We're seeing a lot of maskne. Which is the acne that people are getting exacerbation of their little breakouts on their face because of the mask. Depending on the type of mask that they're using, it could be beneficial for them to use more of the cloth, kind of like the cotton type, because that type of mask will give less rubbing on the face, as well as less issues in terms of dermatitis and contact issues and stuff like that. But we're definitely seeing flares of acne, as well as something that we call perioral dermatitis, which is very common, and it typically happens around the mouth and around the nose area. So definitely treatable. And if you are having issues, some of the recommendations that we're giving out is whenever you can and there's no one around you, remove the mask and remove some of the moisture that you accumulate under the mask, because that's one of the reasons, the bacteria is accumulating in there, as well as just that moist is causing issues with the skin, as well as whenever you can, applying a little bit of moisturizer if you're more on the dry side, and washing that area or wiping that area off will help. And if nothing's really making it better, especially if you're using the medical masks, then go ahead and visit one of a dermatologist or a board-certified dermatologist, PA, someone in the dermatology field. Sometimes we can treat that with medicated creams, as well as in certain cases, we treat perioral dermatitis with oral medication. And it really gets better a lot faster, and it reduces the inflammation in the area. But we think that wearing masks combined with the stress and everything else is definitely causing, the flare up of the bacteria. And just we're seeing a lot of this in healthcare providers as well as in the general population. So it is an issue right now, and it does affect people a lot. So we do want to treat it sometimes with acne medication. Like I said, a little bit of Retin-A at night will help. Washing the mask, if it's a cloth mask, will help as well. Using gentle cleansers, that usually helps during the day, like in the morning when you wash your face, and at night. And sometimes even putting your skincare regimen on hold may help. If you're using too much vitamin C or too much Retin-A, that may actually be working not in favor right now. And so we want to kind of like stay away from things that irritate your skin too much. And sometimes people are trying to put like petrolatum or something like that, and that sometimes just makes it worse. So go ahead and visit a board certified dermatologist if you can get good control over it, because it is an issue, and we can definitely give you the right medication for it.
That's great info and great pointers as well. We all have a different array of masks by now, so I'm going to get out my cloth mask because I had a little bit of that this week. But great info. Tell us a little bit about the dermatology care you provide to the community. You're in Hallandale as well as Boca Raton, and tell us some of the services you provide at those offices.
Absolutely, absolutely. We're in Hallandale and Boca. They're both my locations. However, I do work with a great team of doctors, and we're basically all over. We have our companies called Hollywood Dermatology, and we have a bigger group which is called Derm Care. So we really have offices at this point at almost any area in Florida. And we provide clinical as well as cosmetic dermatology. In general, my practice tends to be a little more cosmetic, but we have providers in my offices that do the clinical services. I do still see clinical patients, and I love the clinical aspect of it. I've just dedicated myself a little bit more to the cosmetic aspect. In clinical, we see a lot of skin cancer, and basically we recommend our patients, a lot of them don't know that their insurance will cover up to 5 visits to the dermatologist a year. And an annual visit is considered part of like your prevention or your like annual visits to the dermatologist. And that annual visit is very important because you do want to get a full body exam once a year. Even if you're not someone that has a lot of moles or that has skin issues, it's important to have a baseline with a board certified dermatologist and then kind of like repeat it every year. It should be part of your physical exam, and it really makes a difference in terms of finding skin cancer. There's a lot of different types of skin cancer out there. There's also precancers, and we can talk a little bit about that. And the precancers are called actinic keratosis, and they happen because of sun exposure most of the time, as well as the most common skin cancer, which is a basal cell carcinoma. And basal cell carcinoma is the most common type, and right after that one, there's another type called squamous cell carcinoma, and they're both pretty much caused by the sun. There are other causes as well as genetic predispositions, but they are definitely very treatable, especially if caught early.
That's great info as well, yeah, on skin cancer. Yeah, I didn't know that we, get a visit, or visits to the dermatologist with, insurance. It's a great thing. Let me give out your info so people can, check with your office with their insurances, etc., and go to see you for not only a mask need, but maybe even to be checked out for skin cancer, because we should, here in South Florida, be thinking about that every year. This is the first year that I actually did that because I noticed a couple interesting looking things, and it's good to get it checked out. We have great, healthcare providers here in South Florida. So let me give out your info. It's Dr. Bertha Baum. It's drbaum.com is the website, drbaum.com. She's also with Hollywood Dermatology and Cosmetic Specialists. That's hollywooddermatology.com. And like Dr. Baum said, she's in Hallandale, Boca, but they even have other locations here in South Florida: Hollywood, Pembroke Pines, West Miramar, Doral. A great website, a lot of info on there as well. So we'll give out your info again during the program so everyone can jot it down. Let's talk a little bit about, now, do you do any removal of skin cancer or surgery, or is that referred to out?
No, I do. And I do check my patients also more specifically for melanoma, which is the deadliest type of skin cancer. And we do want to keep an eye on our moles, especially new moles over the age of 35 should be definitely checked, as well as what we call the ABCDEs. A for asymmetry, B for borders, C for color, D for diameter, and E, which is I think the most important one for the patients, is for any type of changes, or what we call, I can't think of the word right now, but any evolution, any type of different, anything that's evolving in any way, like bleeding or anything like that, should be something that makes you call your dermatologist and get yourself checked. I do skin cancer surgery, and I refer out my Mohs surgery to Dr. Weiss, who works in our practice. He's a Mohs surgeon, and he'll do little cuts and check slowly if all the skin cancer is out.
Great info. Again, it's drbaum.com, 954-456-5050, as well as Hollywood Dermatology and Cosmetic Specialists, hollywooddermatology.com. Dr. Baum, hold that thought. We'll take a quick commercial break. On the other side, we're going to talk about cosmetic dermatology on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. We're here with Dr. Bertha Baum, dermatologist and cosmetic surgeon, drbaum.com, drbaum.com, and also with Hollywood Dermatology and Cosmetic Specialists, hollywooddermatology.com. A lot of locations in South Florida for your dermatology needs. Dr. Baum, let's talk a little bit about cosmetic dermatology, because I know that's a huge portion of your practice. Tell us what types of services you provide. I know there's a long list of them. I was on the website, but we can get into it a little bit tonight.
Now you get me all excited. Okay, so basically we do neuromodulators, which encompass Botox, Dysport, Xeomin, and Jeuveau. They're all FDA approved in the USA. And then we do also a wide array of fillers, all of the FDA approved fillers in the United States, anything in the Juvederm family, as well as Restylane family. We also do Sculptra, which is a collagen booster. So a lot of great biostimulators so that after the age of 20, 25, we start losing collagen production. So it really makes a difference to start early and prevent things, and that's one of the ways that we do it. We also offer a lot of different laser treatments, laser for brown spots, laser for red patches on the face, patients that suffer from rosacea or other conditions, laser hair removal, which is very common in females and males these days, as well as resurfacing lasers of different types. We also do a lot of aesthetic treatments, microinfusions, Kybella treatments for areas of fat pockets like submental fat, what we call the double chin, as well as other areas on the face. Some women like to treat their bra fat. And we also have laser treatments. They're not like a true laser, but they're cryolipolysis to treat areas in the body that bother us, small pockets of fat, as well as tightening lasers. So there's definitely a lot that we can offer for face, neck, chest, and anywhere in the body. It kind of like the list goes on and on and on. But I think, the most important thing is to come in for whatever bothers you and what you're seeing, and we can definitely give advice on what would be the best treatment because it's very personalized.
Do you see a lot of men come in to the office? Because traditionally we think of cosmetic dermatology, think about women, but I think that it's changing.
Absolutely. About 30% of my patients are male. It's pretty good.
Wow. Yeah, that is. Wow, I didn't think it'd be that high. That's great, though. I mean, men got to look great as well, Same thing.
Yeah. Yeah, I think that, like you said, it is changing, and they're excellent patients. My male patients are great. They're very loyal, and they really trust what we're doing. So I really enjoy treating men. It's definitely a different type of treatment that we do in terms of Botox or in terms of fillers, because we do want to keep that male looking type of face instead of feminizing their looks, and the same with females. But if you know how to inject males, it really does make a difference, and they look very natural but really nice.
Yeah, that's an interesting aspect. Yeah, different chemistry requires, a different, outlook on the procedure there. Now, also, do you also offer tattoo removal with lasers?
Yes, we do. We have a Pico laser. That one's actually located in our Hollywood office because we have a laser specialist dedicated to doing that, and it is pretty busy. A lot of people get their tattoos and then they decide they don't want them, or they grow out of it, whatever it is. It is a very good laser treatment because it's one of the most advanced lasers for tattoo removal. It works really good in certain ink colors that you can't get with the older tattoo removals that we had available.
Is tattoo removal a multi-stage process, or is it something that can be done in just one visit? I think it's multi-stage, right?
Well, it used to be very multi-stage. Like people needed 10 treatments, and sometimes with the 10 treatments, they would still have some ink. But with the newer technology, with the Pico laser, sometimes with 2 treatments, it's enough. So it definitely makes a huge difference in the amount of treatments that you can get with this newer technology that we offer.
Let's talk a little bit also about leg vein treatment, because now we're starting to get out a little more. We're getting a little bit of our confidence back. Hopefully, we can squash this pandemic sooner than later. But we're starting to maybe go to the beach, or maybe taking the boat out little by little. And as we get older, men and women, starting to notice leg veins. It seems to just hit at a certain age. Do you provide leg vein treatment as well?
Yes, we do. We treat varicose veins as well as spider veins, and we actually have a specialist, like a vein specialist. I used to do the sclerotherapy, which is the vein treatment, but we did get very busy, and it is very time consuming. So we now have a vein specialist that comes to our location and treats all of our patients, Dr. Lanes. He's great, and he does sclerotherapy with the gold standard, which is called Asclera, which is the best product there is right now in terms of sclerotherapy. And sometimes we will treat them with laser treatment if it's an option. But I'd say 80 to 90% of the time, they are better off by using the sclerotherapy. And he does offer vein ablation as well, which sometimes is needed when there's like severe varicose veins.
Yeah, you provide a long list of, cosmetic dermatology services. Couldn't even list them all, but services and, the practices that you're affiliated with. Let's talk a little bit more, and you kind of mentioned this, but can you talk a little bit about Coolsculpting? Because we all, see different info about it, and then a little bit, you touched on it, but there's chest rejuvenation available, neck rejuvenation, hand rejuvenation, butt rejuvenation, cellulite treatments. Well, yeah, where you treat it all. So.
Yeah, definitely. Coolsculpting is a great machine. We have dual sculpting in some of our locations where we have two machines at once. So you could treat like your left flank and right flank at the same time. It really is the closest thing to liposuction, if you want to think of it like that. It's made mainly for like small pockets of fat. And it really that makes a difference because when you have to have liposuction, you have to go under general anesthesia and all these other things, unless it's tumescent lipo, and it's still pretty intense. So this is great technology. It's basically painless until you get to the massage. It's about 35 minutes where you get connected to the machine. You could be reading, working. A lot of people come in their lunch break and get it done. And then when you get disconnected, you have like this area that looks very red, and we call it like the butter stick because it looks like a butter stick. And then you get a massage right after, and that kind of hurts a little bit, I won't lie, but it goes up pretty fast. And then the massage actually makes the treatment a lot better, so it is useful. And then you leave, you go back to work, and in about 1 to 2 months you start noticing the results. And basically you get rid of the fat in that area. It reduces the fat in that area by 20 to 30%. So expectations are really important when people come into my practice, because obviously if you have an area of a lot of fat, it's not going to just disappear with one treatment. But slowly we can make it better. And if it's like a small pocket, it may improve enough to where you're very happy after one treatment. So depending on what we're looking for, we can definitely get a nice result. The other big treatment that you can do is, like you said, body treatments, and we'll use biostimulators. Sorry, that's my kids. We'll use biostimulators on different areas of the chest, buttocks, hands, and it really makes a difference after like 1 to 2 months when you start seeing your collagen production boost up in that area. We may combine it with laser treatments for the skin itself, because sometimes the chest, on especially females, we do expose our chest a little more on a day-to-day basis with the type of shirts that we wear. And here in South Florida, unfortunately, we get sun all the time in the car, when we're sitting down, sometimes close to a window, and obviously people go to the sun a lot. So just a lot of great treatments out there.
Yeah, great info, Dr. Bertha Baum, dermatologist. Also, we talked, she does cosmetic dermatology, surgical dermatology, works with a great team. Again, it's drbaum.com, drbaum.com, or hollywooddermatology.com. Dr. Baum, thanks so much for the info. We'd love to have you on again. It was an amazing amount of info. Appreciate it.
Thank you. Thank you for having me. I'm available whenever you want.
Thank you, and it was a great show. We'll see you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living long